Hi, I'm Dr. Wolf, the CEO and founder of Wolfpacc. I've been in the academic world as well as the clinical world since 2008. It's been a journey that has been exciting, rewarding, scary at times, frustrating, but the best part of it is seeing students from the academic world succeed, achieving something that they may or may not have achieved before, and in the clinical world, easing the suffering of those who can't ease it themselves. So I think there's a nice overlap between both. And when I'm not at the podium, I'm in the clinic, taking the material that is taught to the students every day here at the program and applied in a clinical setting. In reverse, I take clinical cases and bring it to the program itself, where students have the opportunity to see why this material is so important and how applicable it is to the real world in helping patients achieve better health or a better quality of life. My physiology approach here at the program, or I should say philosophy here at the program, is that medical school structure is complete memorization. You come to school, you memorize a whole bunch of material, and then the following week take a test and purge that mental material to make room for new material. A lot of review programs, and students have many options to take different review programs. But here at Wolfpack, what we do is we try to teach you to look at the questions through the eyes of a physician, basically, individuals writing the questions themselves. I'm very adamant that when looking at a question, I want to look at age, I want to look at gender, I want to look at chief complaint. Did they go to the ER? Did they go to the clinic? These kind of approaches of looking at the question help me understand, hey, if they're going to an ER, then whatever I choose in an answer choice has to be acute. But if they go to a primary care physician in the vignette, then that tells me my answer has to be more on the chronic side. It's little things like this that really make the vignettes doable and definitely achievable. But if I just take a long laundry list, memorize a bunch of words, then when I try to take a test, I'm just hoping I see one of those words. But here at Wolfpack, another technique that we do is we cover the answers. Students at first are a little hesitant to do this, I should say, because we're taught through medical school to do deductive reasoning. Look at the answers, answer the choices based off of that. And what we do here is cover the answers, read the vignette, identify what you think is important. Now, let me explain why we do that approach here. Think about a patient. When you ask a patient questions and elicit the information from them, you have to derive a differential. Based off of the differential that you derive, you'll order specific tests to either prove or disprove your thought process. Well, it's the same thing with the questions. I cover the answers, I read the vignette, I think through what I think this individual may have or what the test writer is attempting to test me on, and then I drop down and I look for it. There's two advantages to this. Number one, I'm not getting distracted by the distractors within the vignette. And two, when I move that piece of paper and I see my answer there, that's an endorphin rush. So many times I have students contact me and say, but I get mental fatigue. I'm tired when I do these tests. It's 8 hours. I'm exhausted. Well, if every question I'm guessing on or not 100% sure that's the answer, of course you're going to reach mental fatigue. By looking down and seeing an answer that you thought of and it's there, that's your endorphin rush. That helps with stamina. And besides, when you're with the patient, they don't have A, B, C, D on their chest. So don't tell me you have to look at those answer choices to derive an answer.